From CareCredit, it's Care Experts, a podcast where we dive deep into the health and wellness industry with the professionals that make it happen. I'm Erin Treloar. Imagine waking up and seeing clearly. No glasses, no contacts. With the help of laser eye surgeries like LASIK, PRK, and SMILE, that's a reality for millions of people. These procedures offer life-changing results, each with its own benefits and recovery time. In this episode, we're joined by Dr. Dagny Zhu, a Harvard-trained, board-certified ophthalmologist specializing in cataract, cornea, and refractive surgeries, and medical director of Envision Eye Centers in Rowland Heights, California. She's here to help explain choosing the path to clear vision that's right for you. Hi, everyone, and welcome to the Care Experts podcast. I'm thrilled to be sitting here today with Dr. Zhu.
Hi, thank you so much for having me.
So I feel like I hear all the time about LASIK eye surgery, and more people are having this done. But we're also going to discuss PRK and SMILE surgeries as well today and kind of compare the three of them so that anyone who's listening can determine which one would be correct for them. Where would you begin if you were thinking that maybe a laser eye correction surgery is a possibility? Where would you begin in knowing if you are a candidate?
So I think being of the correct age is helpful. So typically the youngest patient that we operate on is 18 because by then most of your eye prescription has stabilized. But for some people, it may take a little bit longer for your eye prescription to, kind of not change anymore. And so if you're reading a lot up close on your phone or you're doing a lot of studying, we've seen that can increase your risk of developing higher myopia and nearsightedness even into your 20s. So basically, age is only one factor. We want to make sure that your prescription is stable, not really changed over the past 2 years. So in general, 18 is the youngest we go. And then there's really no maximum age. To be honest, the oldest patient that I've done LASIK on was probably close to 80.
Wow.
And it's because she was super healthy, didn't really have any eye conditions, no cataracts. And so she was still able to see really well with just a laser vision correction procedure. And so age is just a number, as they say. And I would say that applies for, vision correction procedures as well.
Okay, amazing. Now, what are these surgeries typically treating? Is it just working with individuals who have contacts or eyeglasses, or are there other things that they can support as well?
Yeah, that's a great question. I think a lot of people have a misconception about what these procedures do. Some of them think it's like a miracle procedure that cures blindness, right? It doesn't work that way. It's really just addressing that eye prescription that's in your glasses or your contact lenses. So if you don't see well in your glasses or contact lenses because you have some sort of underlying disease like glaucoma or retinal diseases, it's only going to help you see as well as you do for the most part in your glasses and contact lenses.
Okay.
So it's not going to reverse, conditions that we know can cause blindness or damage to other parts of your eye. It's just reshaping your eye to correct that nearsightedness, farsightedness, or astigmatism prescription that people have.
Okay, amazing. So if somebody is over that age of 18 and they're thinking, I am over wearing glasses or I'd like a more permanent solution, they would talk to an ophthalmologist, I imagine, and we've got a variety of different options. What's the difference between LASIK, PRK, and SMILE?
Yeah, great question. So first of all, probably the doctor that they bring this up the most to is their optometrist, actually, because they're like the primary care doctors of the eye, and they're seeing the majority of patients who have prescriptions or need new glasses and contact lenses. So then typically the optometrist, if they're knowledgeable in the subject, they can explain it, but often they'll refer the patient to an ophthalmologist, and not just any ophthalmologist. It has to be one like myself who specializes in refractive surgery, because not every ophthalmologist performs these types of procedures. You have to get someone who's very specialized, has done the training to be able to correct these types of prescriptions with these specific procedures. So once you are able to see a refractive surgeon specialist, they'll pretty much usually do a number of exams to see which procedure you best qualify for. And each procedure is a little bit nuanced in terms of who we recommend each one to. I would say in general, if you've got a normal prescription range that's not too high, you know, above -8 or so, if you're lower than that. And if you have a healthy cornea that's of normal thickness, normal shape, and the rest of your eye is healthy, you would pretty much be a candidate for any of those 3 procedures, LASIK, PRK, or SMILE. The reason most people choose LASIK is because it's just the most well-known, and honestly because it's the most studied. We've had 30 years now of LASIK technology that's evolved over the years, and it's improved, and the technology with LASIK is so advanced today that I think it provides the highest level of vision correction in terms of precision, safety, and accuracy. The other type you might have heard of is called SMILE. That one's a little bit newer. Stands for small incision lenticular extraction. It's a mouthful. And sometimes people get confused. They think it's a dental procedure because of the way it's named, right? So it's a little confusing. The brand name is not quite as strong as LASIK, but it is newer and actually relies on a completely different technology compared to LASIK technology. So LASIK uses the excimer laser to reshape the cornea and treat the prescription, whereas SMILE uses something called the femtosecond laser technology, or laser, to create a lenticule. It's almost like a little donut filling or circle inside of the cornea that you can pull out and thereby remove the patient's prescription, because that lenticule that we pull out changes the shape of the cornea.
Wow.
Yeah, through a small incision, hence its name. And so the laser technology is a little bit different between the two. And I would say that SMILE is newer, so it hasn't been around for 30 years like LASIK. So we're kind of on generation 1 of that laser technology. And the main benefit is that it's a smaller incision, and so there's no LASIK flap. So if with LASIK, we do make a flap on the cornea, which is almost like a thin page of a book that allows us to open the flap and use that excimer laser technology to polish the cornea, and then we lay the flap back down so that there's no wound there. With SMILE, there's no LASIK flap, or there's no corneal flap. You're just making a small incision and removing that lenticule circular donut filling from that small incision. So there's no flap, and that is advantageous for some patients who maybe are at higher risk of eye trauma.
Right.
For example, they do jujitsu every day, or they're in combat sports or boxing, where there's a chance of them getting hit in the eye every day. And there's always a theoretical risk of that LASIK flap dislocating sometime in the future. So without having that flap there with SMILE, there's no theoretical risk of that ever happening. And so I would say that's the main advantage for SMILE. But when it comes to vision and the precision accuracy, I think LASIK's been studied a little bit more, and so that's why it's a little bit more accurate, but SMILE will probably catch up at some point.
When you've had something like LASIK, is it a surgery that lasts forever, or are you most likely going to do it again at some point?
So another great question. I think that's a really common myth that patients have sometimes. They come in thinking that they'll have perfect vision for life. And the other myth is actually on the other side of that spectrum. They think that at some point their vision or their LASIK wears off. So it's like, is it one or the other, right? It's a complicated question. So technically the changes that we make to your cornea, it's with the laser, it's permanent. You know, it doesn't really wear off in the traditional sense. Now, what does happen in about, I would say, 5% of cases, that cornea tries to go back to its original shape. It's, it's always wanting to go back to what Mother Nature gave you. So we notice in some cases, particularly if the prescription was really high to start with, those are the cases where the cornea tends to thicken over time and go back to that original shape. And it never goes back to the original prescription fully. I'm talking about like a very minor level of regression where you'll have like 1 diopter or so come back. Maybe you started at -8 and you've come back at about -1 after 5 or 10 years. For some people, that affects their vision. They're like, I can't see as well as I used to. So I encourage them to come back. And in most cases, we can do a touch-up for that amount that has come back. And then they're good to go from there. And then the other question of whether this, keeps you 20/20 for life, it's a caveat, right? Because what we can say is that in 95% of cases, in my experience, that prescription never comes back.
Right.
But that's not to say your vision's going to stay 20/20 and you won't have other issues that might affect your eyesight. For example, after age 40 or 45, we all start losing our reading vision or near vision due to natural aging. And that happens to anyone, even those who've never had eye surgery. And sometimes patients come back at that point saying their LASIK has worn off, but we have to explain, no, this is a completely different pathology, different phenomenon going on related to natural aging.
Yeah.
And of course, I always tell patients, you've got to keep healthy, control your blood pressure, diet and exercise, because any of that can affect your eye and cause damage, which could lead to vision loss as well. So it's not going to give you perfect vision guarantee, but for the most part, we're going to be able to keep that prescription away about 95% of the time or more.
Amazing. So helpful. So if somebody comes in to your office and they're sitting with you, what are some of the most common questions that people have initially, or maybe myths that they've heard about LASIK or one of these surgeries that they want to know about?
I think they're always, they always assume that it's painful, the procedure, whether it's LASIK, PRK, or SMILE, the procedure itself, you really don't feel at all because we're using numbing anesthetic drops, which basically makes the eye numb within 10 seconds. And so during the whole procedure, really don't feel much at all, and maybe a little pressure at most. And all the procedures are super quick. I would say less than 10 minutes to be done from beginning to end for both eyes. Now, the recovery period, that's when the pain can vary a little bit depending on what procedure you have. So the other reason LASIK is so popular is because the recovery is super quick. Like I mentioned, there's a flap on the eye, and so there's no open wound. We open the flap, do the laser treatment, close the flap. So there's no open wound. And the next day, most patients are already 20/20 with really minimal irritation and discomfort. Now, PRK is the other type of laser vision correction procedure, in which there's also, similar to SMILE, there's no flap. But because of that, the laser is basically reshaping the cornea from the surface, and there's no flap that covers that wound back up. So you have an open wound, and your cells have to regrow over to heal, and that usually takes about a week. And so that first week after PRK, you can have a little bit of irritation and discomfort. And but with the drops that we have nowadays, even with our post-operative regimen, kind of like Tylenol or Advil for the eye, pain is pretty minimal even for PRK, but it's still a little bit more compared to LASIK and SMILE.
So would somebody be looking at PRK for the same reason that they'd be looking at SMILE, and that they don't want the same flap?
PRK is similar to SMILE in that there's no flap. And so in theory, again, if you're engaging in hobbies that might be a little bit physical, PRK could be a great option. It used to be the only option for a lot of people who were in the military or, police officers. But nowadays, with the advances in LASIK, the flap itself is made no longer by a blade. In most cases, made with a laser. And so it seems like the flap is more stable and unlikely to dislocate even with trauma. It's extremely rare. And so even in the military, they allow LASIK as well now.
Amazing.
But just for that theoretical risk, some people may still prefer PRK or SMILE because there's no flap.
Okay, so if somebody comes in, they're going to have their surgery, what would they expect on the day of or in preparation for this treatment?
So in preparation for the surgery, honestly, before the surgery day, we're often prescribing eye drops to use already to get the eyes ready for surgery. So most people already have some level of dryness in their eyes, and dryness can affect your vision and the prescription that we're measuring. It can affect the quality of the scans. And so we want to make sure your eyes are well lubricated so that we're actually measuring the correct prescription amount and your scans are accurate. And the other thing is it decreases some of those symptoms you might have after surgery. So everyone's going to have a little bit of dryness after any eye procedure. It's a little irritation, like feeling there's something sandy or gritty in your eyes. And so the more we treat that beforehand with, over-the-counter lubricants, lubricating tears, sometimes even prescription eye medications for more advanced levels of dryness, it can give you a smoother and, kind of less discomfort recovery after surgery and kind of relieve some of those dry eye symptoms to ensure a quicker recovery.
Amazing. So you're applying the drops, you come into the clinic the day of. How long does the procedure take?
Yeah, so I would say the day of the procedure, most of the time, we're just remeasuring everything again, and that takes some time. And we prepare your eyes with those numbing eye drops, as I had mentioned. And then once we bring you into the operating room, I'm basically spending most of the time just prepping your eyes. So I'm putting a piece of tape to cover your eyelashes, putting an eyelid speculum to keep your eye open, talking to you through the whole procedure. The parts with the laser themselves are only 15 seconds or less.
Wow.
Yeah, so even just the laser treatment part is just a couple seconds. The whole 5 to 10 minutes is from beginning to end of me actually preparing your eye for surgery and then putting drops at the end. So most people are in the operating suite for probably less than 10 minutes. And then I have patients look at a chart in the room before and after they lie down and get up from the laser machine so that they can see the difference already. And they'll already notice, wow, I couldn't see those letters before. And like immediately after surgery, they're sitting up and they're like, oh, wow, they're actually there.
That is incredible how quick that is. And I have heard from friends or individuals who've gotten it done that most people are shocked at how quick the overall procedure is.
Yeah, totally. And, right after the procedure, it's going to be a little foggy. We tell patients it looks like you're kind of swimming underwater, but they can actually make out the letters. Whereas just, 10 minutes prior without their glasses, they couldn't really see what was on the chart.
Wow.
And then by the time they come in the next day for their one-day checkup, most of them are already reading the 20/20 line and seeing pretty sharp already.
Wow.
And a lot of patients tell me they feel like, they wake up that morning and they're like, oh my gosh, I must have slept with my contact lenses in because they forgot that they had the surgery and they're like, the vision's so clear. They're like, oh, I must be wearing my contact. And then they're like, oh, no, I just had the surgery and I can already see.
Yeah, oh my goodness, that
remarkable.
Must be so incredible getting to experience that, because I'm sure for some people it's a minor annoyance to have to wear glasses, but for others this would be really life-changing or give them the capacity to see grandchildren or to show up at work differently. And do you have any stories of people like that?
Yeah, I honestly think the people who get it, they get it for a reason. They really need it. You know, these glasses and contact lenses, it's a crutch for a lot of patients. And the ones I see a lot of are actually like new moms. They're like, I can't be dealing with the baby fussing around, grabbing at my glasses, or like waking up in the middle of the night finding a crying baby, but they can't find their glasses, right? And they're like shuffling around. So it's honestly life-changing for those patients, and similar to the ones who are traveling all the time and they're like, oh, forgot to pack my contact lens solution or my glasses, and they're literally incapacitated for the rest of the vacation, right? Not to mention athletes and people of all walks of life. I find that the patients who end up doing it, they do it for a really important reason, and it really changes their lives. And I can't tell you how many patients I have that just tell me every day that I see them in clinic or on our online reviews, this was the best thing I ever did for myself. My life has been changed. Wow. Thank you so much for changing my life. So that it truly is life-changing for these patients.
Oh, that's incredible.
Yeah.
After the procedure's done, what does recovery look like? And is there any pain involved? Tell me a little bit more about that, even for the 3 different types of surgery.
Yeah, so for LASIK, I tell patients, again, the recovery is pretty quick. The next day, you're able to drive yourself pretty much to your appointment because your vision is actually better than driving level. And again, most patients can read that 20/20 line already the first day. Yeah. They might still notice some halos and glare at night, around headlights of cars when they're driving, which is completely normal. It's during that healing phase. It's going to continue to fade over the first 3 months. And even over the first year, the vision continues to sharpen up. So some things that they'll notice in the beginning, it will pretty much go away by 6 months or 1 year. Okay. But that visual acuity that we're measuring on the chart, like I mentioned, is already close to 20/20 on day 1. PRK, as I mentioned, because there is no flap and those surface cells need time to heal over to cover that wound that was initially made, the recovery can be a little bit slower compared to LASIK and a little bit more uncomfortable, especially those first 3 days is when I tell patients to just go home, like take Tylenol, take the Xanax that we give you.
Yes.
go home and take a nap that first night.
Just rest.
Yeah, just rest, because that first night can be the most irritating with tearing, stinging, foreign body sensation. And then you can still feel that fluctuating vision the first week of surgery as those surface cells are healing. The thing is, we put a contact lens, a special type of contact lens in the eye for PRK patients that first week, has no prescription. Its only role is to protect the surface of the eye and actually enhance comfort. So your eyelid's not rubbing on your eye and causing pain.
Yeah.
And so after 1 week, when we remove that special contact lens, the vision sharpens up a lot more because the surface has mostly healed. And typically by 2 weeks, they're seeing close to what a LASIK patient would see on day 1. And then it continues to sharpen up because the eye is still remodeling that surface. So by 1 month, they're really good. And then I tell them it's going to keep sharpening up to 3 months is when you're pretty much at almost your final result. And then, like I mentioned, even with LASIK, up to a year, you continue experiencing small levels of improvement for PRK.
Wow.
And then for SMILE, I would say it's somewhere in between. So SMILE has a pretty quick recovery time, similar to LASIK. But because we remove that lenticule, there's still some swelling in the cornea that can lead to a little bit blurry vision the first day. So you might not be 20/20 the first day, but probably by the first week. And then it continues to improve from there. So still a quicker recovery overall compared to PRK.
It honestly sounds so simple, like it's almost too good to be true. And then these results that people are having, I'm sure some people go and have this treatment and are like, why did I wait so long to do this?
Yeah, that's actually the most common thing I hear. It's like, I regret not getting it sooner. Like that's my only regret.
Yes.
But I do want to remind people that, this is still a medical procedure. You're not going to just be going in and, one and done, buy a Groupon. It's the same everywhere. You know what I'm saying?
No.
Absolutely not. It's going to depend on the experience of your surgeon and the center that you choose.
Yeah.
And I think people's experiences might differ because of that difference in quality. And I think not only based on the technology that's used, but how you're being evaluated for your candidacy before surgery. Are you getting treated beforehand with the appropriate drops for the appropriate amount of time? Yeah. And then after surgery, how are you being treated? What drops are you using? If there are any complications, how are they being managed? And these are all really important in terms of achieving the best overall outcome. And I think people tend to forget that all of that is important. And it's important when it comes to any medical procedure. And laser vision correction is still a medical procedure. We're not going to say, you're guaranteed 100% 20/20 vision, no risks at all. No, absolutely. It's just like any other medical procedure. Please do your research, make sure you find someone qualified to make sure that you are actually a good candidate for this particular procedure. Or we could recommend a different option because there's so many different options for laser vision correction or eye correction procedures in general today.
Amazing. I love that there's still options available. So I feel like the very first step is always booking in and talking to an expert in this area, doing some research before, bringing all of your questions in and getting that information from a true expert. Are there any technology updates that you're excited about in this area, or anything that you feel is important for people to know around the technology side of things?
Yeah, even within LASIK itself, the laser technology is constantly improving. There's now something called Wavelight Plus LASIK, which uses ray tracing technology. And what that is that it's actually making like an AI twin model of your eye.
Wow.
Yeah, from not only the front of your eye, which is the cornea, but going all the way into your natural lens to the back of the eye. So it's measuring all the abnormalities within your eye, creating this AI digital twin, and figuring out what laser treatment pattern would best correct all of that from the front to the back.
Wow.
So that we're getting even higher levels of visual acuity than we could ever before with LASIK, to the point where you might even see better than you do now with contact lenses and glasses. So I think the recent data that came out with this technology, close to 50% of patients were getting 20/12 or better vision.
Wow.
So to put that into perspective, the lower the denominator, the higher the visual acuity. So 20/20 is considered perfect.
Yes.
You can have better than 20/20, 20/15, 20/12, and 20/10.
Wow.
So with this new laser technology that we have advancing, over the past 30 years of research, constant development, we're getting levels like superhuman eagle eye levels we've never seen before. So that's been very exciting.
It's such an exciting time in the world of medicine as technology just becomes smarter and smarter. And I can't wait to see how everything continues to change in this area and beyond. I have some incredible questions from our audience that I would love to ask you for our Ask Me Anything section. The first one is, I'm in my late 40s and starting to need reading glasses. Can any of these surgeries help with that, or is it mostly for nearsightedness?
Yeah, that's a great question. That's actually somewhat complex because every 48-year-old is going to be a little bit different. And so for some patients, absolutely, at 48, you can still get LASIK or PRK or SMILE to correct both distance and reading vision through something called blended vision. Now, not all patients tolerate blended vision. They feel a little awkward with one eye seeing distance and one eye seeing better for close. So for those cases, I would recommend something called a custom lens replacement.
Okay.
And that's when the natural lens in the eye, I mentioned it's lost almost all its flexibility to the point where even adding a little bit of nearsightedness is not enough for them to read, or they feel a little bit too balanced, adding too much nearsightedness. So in those cases, I recommend something called a custom lens replacement, where we actually take out that lens, that natural lens that's really not functioning anymore. It's too old. It's lost all its flexibility, and replacing it with an artificial lens that actually has multifocality, meaning it's going to give you good vision at different focal points, far, intermediate, and close. So that works for a lot of patients who are generally older than 45 and don't tolerate blended vision and who still want that full range of vision.
Amazing. Okay. I'm planning to get LASIK and everyone keeps saying it's quick and easy and it'll be the best decision of my life, but I'm still feeling a little nervous. Do you have any advice or tips for staying calm during the procedure?
I've had all kinds of patients in my surgery suite, the most nervous, anxious people you can think about, and not a single one has ever bailed out of surgery in the middle of it because they couldn't overcome their nerves. Literally, there are so many things that we can do to make you feel comfortable. The numbing drops themselves, again, take away all pain. So really, you should not be having pain through the procedure. Most of it is mental, right? Your anxiety. Every patient gets a little pill, usually Xanax, that helps to calm some of those nerves before surgery. And it works pretty well for most patients. And then the patients who need a little bit extra, we give them like a little squeezy ball for their anxiety to squeeze. Sometimes that's the hand of my technician during surgery.
Right.
And he'll literally hold their hand during the procedure. And he's like, don't be afraid to squeeze if you need. That seems to help a lot. I had patients even meditating during the procedure.
Amazing.
Like literally they're counting down themselves. They're doing breathing exercises and I'm counting with them, And then most of it is just me reassuring the patient throughout the procedure. I call it verbal anesthesia. And so patients always tell me after surgery, they're like, Dr. Zhu, has anyone ever told you your voice is so calming? Like, that's literally the only way.
Why, yes, they have actually.
Exactly. They're like, that's the only way I got through this procedure. It's because I tell them exactly what I'm doing and what's coming up so they know what to expect and they're not as scared. So
you have a very calm presence in general. So I feel like that would translate through so well in the room. All right, both my parents need glasses. Does that mean I'll probably need them too down the line?
So unfortunately, I would say some eye conditions like your prescription or nearsightedness, it definitely has a genetic component. And so typically if your parents have a high prescription for nearsightedness, you're probably likely to have it as well. And I think just in general in this world, we're trending towards greater and greater levels of nearsightedness worldwide. By 2050, like half the world's going to be nearsighted. And we think part of the reason is because we're moving more indoors on our screens. And there's really great scientific evidence linking nearsightedness to absence of sunlight exposure when you're young. So that's why we say the healthiest thing you can do for your kids to make sure their eyes are healthy and stay seeing well for as long as possible, Get them outside, play outdoors under the sun, play sports. Do not stay indoors on those screens all day, because we know that that is a risk factor for just increasing levels of nearsightedness every year.
Such an important point. Okay, our last one. I'm getting married next year and would love to be glasses free so I can really see and enjoy the day. How far in advance should I start planning for vision correction?
Yeah, that's great. We have a lot of patients who are doing it for a specific event. A lot of times it's for a wedding, or even I have students who are taking their board exams, right? And they want to get it done before then. Surprisingly, you don't have to space it that far out in advance because of the rapid recovery, like I mentioned, specifically with LASIK and SMILE. I think in general, a week of recovery is all you really need if you wanted to push the boundaries.
Yeah.
In terms of your vision, you'll probably see well already by that 1 week. Maybe you'll still have a little bit of redness, so I recommend pushing it out maybe at least a month just to be on the safe side, just so your eyes are perfectly white for that, picture perfect day or your wedding day, and just to make sure there's no other issues that might come up after surgery that requires further treatment or eye drops.
Yes. Amazing. Well, thank you so much for being here today and for answering all of these questions. I know that anybody who's listening right now is probably feeling so much more informed and at ease as they make this decision for themselves.
Yeah, thank you so much for having me. I hope it was helpful for your audience, and happy to be here.
Hey there, don't leave yet. Just wanted to say, if you want to hear more about health and wellness, check out these episodes of Care Experts. Also, before you go, make sure you like and subscribe. New episodes drop every Wednesday.